Hey, you guys, Dr. Nicole here, answering the question for you, what the heck do I expect to happen at the first pelvic PT session? We get a lot of people at our clinic that might be a little bit anxious about that first time, and you're thinking like, pelvic PT, what does that mean? What are they gonna do to me? And so I'm here to tell you what to expect at a pelvic PT first session. The first thing that you're going to do is you're going to come into the office, and you usually have to fill out some forms. Sometimes you've done that before. That gives us a huge snapshot as to what symptoms your pelvic floor might be causing. And sometimes they might be causing some stuff that you don't really know can be related to your pelvic floor. So you're going to be asked about your bladder health, your bowel health, your orthopedic history, and your sexual history. It's really important that we get that full breadth of what the pelvic floor functions are and what symptoms that might be lurking that you've ignored for a while that can actually play a role in your whole pelvic health picture. We also ask you about your pelvic health history, including if you're a female, if you've had a baby. We ask about your gynecological history. We ask about surgeries, medications you're on, other physicians that you've seen, other healthcare providers that have seen, and what has helped and not helped. If you're male, we ask also about your prostate history and whether or not you've been to a urologist, and get just as good of a snapshot and a history of your pelvic health that we can possibly get. We also take a look at your diet, your lifestyle, your stress levels, how you manage stress, because that can also play a role in a lot of pelvic floor functions. So once we have a full history, then you come into a private treatment room and you get to talk with the pelvic PT first. This is with your clothes are totally on at this point. We can have a conversation about, in your words, why you're here and what you really want to get out of your pelvic PT treatment plan. So we can create goals together that both you and I understand together. Then we get to the actual examination part. Now, at my practice, we do both an internal and an external, usually on the first visit. We want to get the biggest overall snapshot picture of your entire body and how your entire body plays a role in your pelvis and pelvic floor. So this can obviously be individualized based on the patient, but in general, we start with a movement exam. We have you move in a bunch of different ways. We have you do a task if it's something that is bothersome to you. We have you lunge and squat and bend over and do all kinds of things, stand on one leg, weight shift, do all kinds of movements. Then we actually look and do an external exam on your abdomen, your rib cage, your inner thighs, your hips, low back, sacrum, pelvis, all the way down to your toes. Sometimes we have time to get up to your head and neck. Other times we leave that for a different day. And then after we do a full external evaluation, then we have the choice to do an internal evaluation to complete the full picture of your pelvic health. And that usually involves an internal exam. And with the pelvic floor, anything that you see here in red is muscles, and anything in here. Now, these muscles are mostly covered by our big gluteus maximus and other muscles and fascia. So the easiest way for us and the most efficient way for us to actually assess these muscles is through either the vaginal canal or the rectal canal. And this sometimes seems a little bit scary and kind of like, what the heck are you even doing? But the reality is this is so different from your gynecological exam or the exam that you got at your urologist. Whether you're male or female, this is not a typical physician exam. And in fact, your physician usually is not well trained, if at all, in this musculoskeletal exam of the pelvis and pelvic floor. Sometimes they know what the pelvic floor is, but they sure as heck don't know how to assess it very well at all, even your highest level trained urogynecologists, urologists, and OBGYNs. And I know that sounds surprising, but it's totally true. So what we're able to do is, in a female, we're able to actually insert one finger with a glove, and we're able to actually feel each of these muscles. And now with that extensive external exam and the pelvic health history, we're able to say yes or no, are these muscles contributing to the symptoms that you are coming in to see me for? Hopefully the answer is yes, so we can do something about that. But even if the answer is no, that gives us a ton of information for you to go back to whatever other healthcare practitioner that we feel is best for you to go along your healthcare journey and get these symptoms resolved. So again, in the vaginal canal, one finger, we usually do one side and then the other. What that actually allows us to do, if you can see here, is actually feel each one of these pelvic floor muscles. We can't feel these from the outside. If you're male, or a female that doesn't want the vaginal canal to be palpated, we can actually palpate through the rectum as well. And so what that allows us to do is it allows us to feel the tailbone really easily. We can feel it vaginally as well, but it's really close if we go in rectally. Again, this is, just one finger. It's not invasive like sometimes the urologist, or you're bent over a table and asked to do all kinds of coughing and whatever else you're doing. But it is very simply just to feel the muscles around the pelvic floor. So again, we can see, are those muscles related to whatever you're coming in for, either a bowel problem, a bladder problem, a pain problem, a sexual health function problem, anything. So after that, we will come together again, you'll get your clothes back on, and we will talk about what we found and putting the pieces together for a hypothesis as to how we can potentially help you to resolve some of those pelvic floor symptoms. Everybody at my clinic usually leaves with a short homework, which is either stretches, exercises, or something to pay attention to that will give us more information when you come back. That second visit, then we add a lot more treatment, and then we also will maybe choose to look at another area in depth if we didn't quite get as an in-depth evaluation as we wanted to that first day, because there's a lot of stuff to go over and there's a lot of stuff to talk about on that first day. So after that first day, you'll have some treatment, you'll pay attention to something, you usually have a homework assignment to come back in, and then we can go from there. So I hope that helps to decrease any anxieties you guys have about pelvic floor dysfunction treatment and or going to a pelvic health PT. You always have the opportunity to talk to us before we do anything also, so that we can get on the same page with how far we want to go during the exam. But ultimately, we need to get a good picture and think about it as a big, huge picture all the way from head to toe, including the internal component, on how everything is working together in order to create these pelvic floor symptoms that you need help resolving. So pelvic PT can be a really great place to do that. We happen to be the experts in the pelvic floor muscles, and we're usually really excited to help you to get on your way and decrease those symptoms and help them to go away and also stay away. I hope that helps you guys, and I hope you guys have a wonderful time at your pelvic PT.